going to talk to you about very basic fundamentals of how to bring a change. Let us try and think about how we develop. And the whole consciousness process begins in the first trimester of pregnancy to 6 years. And 90% of it is subconscious mind we use. And subconscious mind is the mind which we inherited our habits. We have limiting directions from the parents. It is 70% of them is self-sabotaging and disempowering. But at the same time, this mind is enormous capability of creativity. It's an instant mind, and only 10% of it is the conscious mind. Now, if you ask me, miracle lies in the conscious mind. It's not either or, it is a better coordination between your analytical capabilities lie in that, and because this mind is in direct touch with the superconsciousness, things happen in this mind. I'll give you my own example, and there could not be a better example. Believe me, I didn't create it, it happened to me. Just 48 hours ago of this webinar, in my usual 5-mile run, in the last lap, I ignored a manhole cover and fell down flat on the road. You can still see telltale signs. There was nobody on the road, and I was bleeding from nose and mouth. My teeth were intact. I think within 10 seconds, honestly, I had 3 thoughts, which I'll share with you. One, I am fine. Mind you, there is a difference between I will be fine and I am fine. Nature repeats exactly what you say. There is no iffy thing. I'm fine. Second thing, this webinar one was on my head, to be very honest. So I said, I am doing this webinar. I didn't know because I didn't have a mirror to see what would be my shape. And the third thing was a reminder that there is something, whatever has happened is for the larger good of me. And there would be enough time for me, what is the good? Now, it is a subject of a talk itself, that what lessons did I learn? But that is the beauty of conscious mind. It is 48 hours, 3 days. I haven't interrupted my routine. I haven't done any treatment. I am not advising you. I could have taken 2 options. Let's analyze. I wear a watch which senses the impact, and immediately watch was sirening. You had a fall. Should I call 911? I could have gone that route. But there was a confidence or something ringing within me, I am fine. And that's what universe did to me. Now, there is a catch here. You say, I am fine. This is a jargon. You meet people in the lift, you meet them, they have long faces, which is obvious public face. They can't hide what's going on them. But first thing is, no, I'm fine. It doesn't work that way. Until you believe you are fine, until you really believe you are fine, it's not. And for that, you can't believe all the times, I agree, but then you have to have affirmation to remind yourself that you are fine. So this is how it works. This is the word perception, and this is our 90% of the activities in which is spontaneous activity. It doesn't analyze. You are driving a car with the reflex, you are reaching to your home, and you don't need a GPS for that. But then when it comes to reasoning of the mind, it is the conscious mind, and that's where the miracle lies. And the spontaneous healing, if you need, all those who work in medicine, I am not talking hopes, I am talking evidence-based medicine. The spontaneous healing, the miracles, you find somebody who has cured his cancer with juices, or somebody who has empowered himself to treat his moribund disease, which has been said no by the medical profession. It can happen. You need to believe it. Now, what is this? This slide is very dear to me. You have to explore. You have to explore. We have to get out of the rut of handing ourselves to the doctors and the hospitals. They are our custodians. It's good to be an obedient patient, but you have to explore. You have to explore what is within yourself, the power of within yourself, power of your thoughts, power of what you speak, what you say, and what you feel. And then if you get into that paradigm of consciousness and unconscious mind, you will find that it's an automatism. Automatically, you would be dragged inside. You just have to take the first step. And that is the basis of my talk. That how do I get you out of your bed when you hate to get up early in the Sunday for a run? How do I push you out? If you take the first step, believe me, all what is required. You don't need the advice of these experts. Automatically, you would be advised from within. You will research that you have inner pharmacy, and your external agents and intoxicating agents like alcohol, drugs, and substances are secondary. You require very small amount of endorphins to give you a kick in comparison to bottles and bottles of alcohol. But that is something nobody else can do for you. You have to empower yourself. And as I said, I can guarantee, including us, 90% of us, we have outsourced our health to the doctors and hospitals. We have very recently, we have treated close to 50 patients during COVID and given consultation, maybe over 50 patients. And we are collecting data from them. And 90% of them are keenly waiting to do even exercise that we'll talk to the doctors, because we have had a heart surgery. As soon as it opens, we'll go back to the doctor and the hospital. That kind of comprehensive turnkey outsourcing is the biggest self-defeating concept you have. You have to insource yourself. You have to apply mind. A doctor, I have practiced as a doctor for decades. A doctor can give you at the best 10 to 15 minutes to understand you. Who can understand better than you yourself about your health and yourself? So please consider insourcing rather than outsourcing. What I found that when I talked to these patients who consulted MediCounsel for their emergency situation, in lockdown situation, I changed the concept of the MediCounsel. Because Pratik said that we were totally allopathic biased, bringing multiple opinion, and we were not garden variety for your cough, cold, and ordinary fever. We wanted it to be for complex diseases, more than one specialist involved, and we wanted to have our USP was collective wisdom when we'll make people to talk, which is very hard in our profession, to talk to other specialists to give a candid opinion. There are exceptions, but it's not a usual convention. So we changed it and we said that we will give talk of integrative medicine. And integrated medicine is, which is not a one color bias, it is integrated, and you look how beautiful it looks like, which means lifestyle changes. And that's why you see these beautiful ladies who are going to talk to you, why we changed it. And now we talk of the primary cause. If somebody is not able to walk, I'm talking of a patient in Hyderabad, it's not because his osteoarthritis is a problem, but because he's morbidly obese. And any joints would wear out with an extraordinary amount of weight you have done. So with that, I would say that We are here to help you if you are looking for clear directions. We can't give you better than what you already get from your doctors, but I can assure you, we can give you clarity of thought. We can give you clear options with reasoning that what you should do, but the decision is yours. Thank you very much.